All right, good morning, everybody. Welcome to our third installment of this workshop. My name is Leslie, and I'm joined by my colleague and peer, Chad.
Hello.
And we are here from Adler Community Health Services in conjunction with Providence Healthcare to bring you a workshop regarding wellness check-ins and how you can support staff with wellness check-ins. So we'll just briefly go over the agenda for the day. For the next 75 minutes, I should say, not the whole day. So we're going to talk about wellness checks, what they are and what they are not. And we're going to talk a little bit about why we're even doing these checks. So looking a little bit about burnout and its impacts on not only the staff themselves, but the team as a whole, and then the hospital itself as a workplace environment. We are also going to discuss when you utilize a wellness check, and then actually the last component will be how to do the wellness check, and we'll walk you through sort of the steps and the components that are involved in a wellness check. So before we jump into all the good stuff here, we do ask that as part of your participation in this workshop that you complete the survey at the end. And so we've just put up the QR code here now just to kind of honor the folks that may have to skirt out a little bit early for other commitments or meetings. And we just ask that if you know that you might have to leave a little bit earlier, that you kind of take a scan of that QR code so that you have access to the survey. And then Chad's also just put the link in the chat box there. So if you just want to open up the web page and kind of have it ready, it's a very brief survey. It should take you 1 to 2 minutes, but the feedback is very important for us and helps shape future workshops and webinars and to tailor it for your needs as staff. Okay. So as we move through the content of this presentation, there's just a couple of questions that we want you to, or I should say, encourage you to keep in the back of your head and consider as we move through. So things like, when is it appropriate to do a wellness check-in? We recognize that you're all working in different units or in different areas of the hospital. And so just considering what works best for you and your needs in terms of your leadership style. Also, how can you manage your own expectations during a wellness check-in with a staff member? And also taking time to consider, how do you consider the wellness of your team as a whole? Is this something that you have considered previously, or is this something that kind of has been off your radar? So just taking a moment to check in with that. And lastly, how you can foster your own strengths as a leader to lead a wellness check-in, whether that's individually for a staff or in a group situation. So let's jump into it. What is a wellness check-in? So a wellness check-in is really a responsive and a proactive way for leaders to be accountable in creating a very psychologically healthy and safe work environment. We've seen, especially throughout the past 2.5 years, the impact of the pandemic on the well-being and psychological safety of individuals as a whole in our communities, and even more so for folks that are caregivers and are working in a caregiving profession. So the wellness check-in really provides an opportunity to connect with an employee or a staff member around their current state of psychological well-being. And then it also has an action step with it. So it's about considering relevant actions and support needed for that individual to kind of bolster their well-being in the workplace. These check-ins are planned and they are brief. They are not counseling sessions. It's a one-to-one conversation between you and the staff member. They are occurring in a confidential space, and they are really an authentic and genuine conversation between leadership and the staff. And the idea here is that it's not a punitive conversation. It's not evaluative. It's about really supporting that individual to kind of be the best work versions of themselves. So as I mentioned, what a wellness check is not. So it is not a counseling session. You are not counselors. Well, I'm assuming some of you are not counselors, and so that's not the role that we're asking you to take on in this kind of a check-in. So you can leave the counseling to folks like myself and Chad and our wellness team. That's our service provision. So this is really just a conversation and a check-in. It's not a counseling session. A wellness check-in is also not a critical incident debriefing. So this is not happening after a critical incident, and this is not focusing on the critical incident. Now, it might be dealing with the aftermath and the effect for that individual, but that's in the realm of wellness for them as a whole, and not in terms of its direct relationship to the critical incident itself. And lastly, a wellness check-in is not, as I mentioned, it is not evaluative. So it's not focusing on performance management issues. It's really honing into the psychological safety and well-being of the individual in the workplace.
And I think that's one of the many challenges of doing a wellness check-in, is that it would feel like kind of a performance review, especially if it's coming from higher management checking in on another staff member. So I think we'll be talking more about that later on as well. When it comes to doing a wellness check-in, it's important to be aware of the signs of burnout that you notice among your staff, especially within the individual people that are in your team. What is burnout? It usually involves a physical, emotional, behavioral levels of stress or distress as a result of chronic, repetitive, negative responses to any stressful workplace condition. So as I'm listing out all these signs of burnout, I want you to think about which one of these symptoms or which one of these signs are physical, emotional, or behavioral. And these are things that you want to look at in these three different domains. So signs of burnout can include lowered levels of motivation, increased errors at work, increased frustration, increased irritability, perhaps sarcasm in a point from a negative point of view. So negative sarcasm, ones that are not maybe as professional as you see them at, or out of the realm of whatever sarcasm is negative, whatever that might look like to you. Other signs of burnout can include reduced efficiency and energy, overall fatigue, suspiciousness of others or hypervigilance, headaches or any somatic symptoms. It can also include more time spent working with feeling less accomplished. And in extreme cases, you'll have self-medication and alcohol or other substances, and debilitating self-doubt. So self-doubt that stops you from even initiating tasks, especially tasks that are important. It's really difficult to identify burnout in ourselves. So I think that's why it's really important for other people to be able to, for there to be an opportunity for people to check in on staff members. So that's what a wellness check-in is for. Oftentimes we tell ourselves so many lies about how we feel. For example, I am fine. I'm happy to take on more work. I'm not burnt out, I'm just tired. No one else can do this work but me. People are depending on me. I just really want to be helpful. This moment will pass. If I take a vacation, all of this will be okay. Think about all of the other times you've mentioned that to yourself, you said that to yourself, and those could be perhaps, and not always, but perhaps they're red flags for maybe you're entering this realm of feeling burnt out. So again, I asked earlier to reflect on what symptoms might be considered physical, emotional, and behavioral. Physical signs of burnout can be feeling drained, tired, anything to do with the physical body. Emotional can mean any emotions that are tied with detachment or loss of control. So feeling helplessness, feeling trapped, feeling defeated, increased cynicism. And what are the behavioral consequences of that? Well, perhaps withdrawing from responsibilities, making more errors, substances to cope, or taking out frustrations on others. Another way to look at burnout is where they fall in this continuum. So on one side, we have disconnection, the other side, we have enmeshment. And noticing what burnout would look like in the person that you're looking at. So burnout can look like so many different things. On the disconnection side, it can lead to it can show up as negativity, cynicism, avoidance, numbing of feelings, and oftentimes people at the disconnection side of burnout are more staff-centered. So that means that they only focus on themselves, or they focus on the staff, their teammates, and not really on the patient. Whereas on the enmeshment side, you might see this feeling that you're the only person who can help. You might see boundary transgressions between the nurse or staff and the client or the patient. And on the enmeshment side, you're really enmeshed with your work, and it feels worker-centered. You often get feelings of hopelessness in this area. So it's like shoveling water. What are some possible consequences of burnout? So we have personal. It can lead to poor physical health, stomach pains, gastrointestinal pains, migraines, back pain, chronic pain, headaches, etc. It can lead to clinical depression. So if you boil it down to all of the feelings of disconnection, the hopelessness, the worthlessness, over time that might lead to a greater severity and mood disorders, including depression. It can also lead to increased risk of accidents, not just at work, but also at home. And then also noticing a decreased attention to proper hygiene. So that's one of the consequences of personal consequences of burnout that you might pay attention to. What about workplace consequences? Well, people often report reduced job satisfaction, decreased productivity, and not showing up to work, increased absenteeism. There's also the impact on the overall team, right? And I think as therapists in training, we recognize in group therapy that emotions are quite contagious. So when someone is feeling burnt out, there's this effect that it might infect the entire staff, and that other people might pick up on that burnout. So it can lead to it can lead to poor workplace morale, communication breakdown, and also increased turnover.
Okay, so Chad just went through sort of the different levels of impact that burnout can have. And one of the beautiful ways that we can sort of illustrate this is by looking at this mental health continuum and performance overall. So sort of as that stress and that burnout increases, we're leading more towards illness, as you can see on this continuum here. So when your staff are performing sort of at their best, at their height of their well-being and their wellness, you're getting a consistent level of performance. You're getting folks that are excited to show up to work, excited to participate, collaborate, and engage. It's important to notice that burnout isn't kind of like a switch that happens, you turn on and off. It's kind of a progressive experience, and it doesn't happen right away. So as the burnout levels increase, your mental health is going to sort of decrease and deteriorate. And you might start noticing other behaviors like procrastination, sort of this reactive phase. You might also start to see stuff like low motivation, as Chad mentioned, some irritability. Once we enter into the injured phase, we're really seeing a decrease in performance overall. And this is when mental health really is starting to break down now. So you're seeing some more sort of detrimental effects here. Once the mental health is really kind of deteriorated, the person is now considered ill or in the illness phase. And this is when sort of that fight, flight, or freeze response is totally turned on. There's a frozen state. There's an inability to actually perform their work duties, and there might be a leave of absence here. So this is ultimately what we're trying to avoid. And so that means that we are not intervening when we're already at the illness phase. We are intervening much earlier, and in fact, we're doing that in the reaction phase. So when are we checking in? So as I mentioned, we are not doing this when we're already at the deterioration and that individual has requested a leave of absence from work. That's too late. We've kind of missed our opportunity to check in and to support the well-being of the staff member. So we're checking in when we're starting to notice a change in behavior. And so you are going to know your staff better than myself or Chad, for example. So you're going to recognize sort of what their optimal functioning is and when their performance is consistent. And then you will also notice when there's a deviation in that. And that should sort of be the first red flag that goes off for you. So a change in behavior or a change in performance is a really important thing to keep an eye out for. Additionally, when you start to notice a behavioral trend or a pattern, so for example, this person is generally on time for work or early for their shifts, and all of a sudden there's 5 minutes of lateness, and then that's kind of gradually turning to 10 minutes of lateness, and there's a trend now happening. That might be a time that you suggest to check in. And lastly, when another employee or a colleague approaches you with a level of concern or maybe a complaint about the staff member's performance or ability to carry out their role, that would be a time to kind of reflect back and think to yourself, is this a time when I should offer a check-in?
Mhm.
So as I mentioned, we're doing this in the reactive stage. So in the healthy stage, generally in the workplace, we're seeing a calm and steady employee. We're seeing typical mood fluctuations. We're seeing someone that is, taking rest when needed, showing up to shifts, kind of well rested and ready to engage in their workplace duties. We're seeing someone that's, engaging in healthy nutrition and taking lunch breaks and taking snack breaks, and they're just kind of really engaged in their workday. There's a confidence in that individual. They're socially connecting to their colleagues and their peers in the workplace. And there's some lightness. There's maybe some humor or some kind of jovial aspect to their interactions. So the check-in itself is most useful in the reactive phase. So this is when you're starting to pick up on some irritability or some maybe quicker to anger behaviors in staff members. Impatience is a big one to look out for. Also seeing if someone is starting to exhibit some low energy or fatigue, forgetfulness, procrastination, sort of these little minor cognitive effects that we see at the beginning of burnout. So like I said, forgetfulness, procrastinating tasks, just some absent-mindedness perhaps. Poor concentration, again, that might be a behavior that you pick up on. Or if they're just more reactive as a whole, perhaps swearing or cursing, and this is a deviation from sort of what they're typically like in their workplace. So the goals here are really to minimize the stressors, whatever's occurring. That's where we want to intervene, and we want to try and minimize the stressors for the individual. Well, as we progress to the injured or the illness phases, that's where you're going to see kind of perhaps more unacceptable behavior in the workplace, particularly when we're talking about a healthcare environment. So one of the big things to notice in the injured list there is impaired decision-making. This can have dramatic effects, especially in terms of patient care. So that's something you want to kind of have an eye out for. You'll notice at the end of the list there, and it's something that Chad also checked in on, is overlooking details in appearance. So that kind of the self-care, personal hygiene is one of the first things to go when we're starting to experience burnout, because we're trying to just basically make it to the workplace. We don't care about how we're presenting ourselves at that point because it took so much effort to even get there. So that is a really good cue for you as leaders to kind of take a step back and go, this might be the appropriate time to check in. And then again, as we mentioned, when you get to the illness phase, we're kind of, we're so far past the place of intervention here. So this is often when folks are demonstrating panic attacks, anxiety. There's more angry outbursts in the workplace. There's severe memory lapses, an inability to concentrate, and an inability to basically perform their basic workplace duties. At the extreme end, as Chad also mentioned, we might see things like suicidal ideation or intention. We might start to see the addition of substance use in terms of coping, and then just withdrawal as a whole from the workplace. So this is where, you know, if we're seeing a staff member at this stage, this is really when we want to ensure the employee has access to a range of supports. This might mean connecting with human resources or other managers to support them, and this might mean a leave of absence. Okay, so there are some times when a check-in is not warranted. And so again, if you're already engaging in a performance review, we are not adding a check-in at that time. There's an evaluative valence to a performance review. And so that's really not the appropriate time to be checking on someone's psychological well-being, because they're already sort of being you know, they're under the microscope, so to speak, in terms of their behavior and their performance at work. And so there's a lack of safety in terms of discussing their own psychological vulnerability. So we are not doing these wellness checks during a performance review. We are also not doing a wellness check right after a critical incident. A critical incident debriefing is inherently different than a wellness check. So a critical incident debriefing is going to bring upon a lot of responses psychologically and physically for a staff member. And again, that is not the time for the wellness check. The wellness check is to be done separately from a critical incident debriefing. During moments of distress as a whole. So if a staff member is having an emotional reaction to something, or you are viewing them as highly distressed, that is also not an appropriate time to do a wellness check-in. We want both parties, including yourself as leadership, to kind of be at an emotional baseline to engage in this kind of conversation. So we want the distress levels to come down so that a really healthy dialogue can occur. And that's sort of connected to our last point here. You as a leader, when you're feeling emotionally dysregulated, or if you're feeling like you don't have an ability to have the space for that conversation at that point in time, it is not the time to do a wellness check. A wellness check requires you as the leader, or you as the kind of facilitator, to be very present and attentive to the other individual. So you yourself have to be in a very healthy psychological space to engage in it.
Yeah, and just thinking about when to do a check-in, it's asking yourself, when is it a safe time and safe space for me and for the person to engage in a wellness check-in?
All right, and so just some perceived barriers to a wellness check-in that we've sort of gathered over our experiences. The first and foremost is that it takes up too much time. We know that there's a staffing shortage right now across healthcare communities, and so, you know, taking a staff away to have this type of a conversation in terms of taking them away from patient care might be sort of not your first go-to idea. And so there's this idea that it takes up too much time, but let's try and reconceptualize that by putting that time into the employee, we're actually hopefully going to get more output in terms of work performance because we're attending to their needs. Mental health stigma as a whole. So either your own stigma of mental health and your own biases and judgments about that, or not wanting to stigmatize the individual that you're engaging in the conversation with. And so that might be a kind of a perceived barrier to actually taking the initiative to start this conversation. An inability to handle what is being shared, so having a lack of skills. And we're actually in the second component of this, when we jump into how to do the wellness check, we're going to teach you how to deal with things that are being shared that are perhaps too emotional or too personal in the conversation. So kind of not having the skill set to run a wellness check is a perceived barrier, but hopefully from your participation today that this isn't a barrier that you face. Fear that the employee's distress might trigger your own distress. And so again, that comes back down to making sure that you yourself are in a really psychologically healthy space to engage in this conversation so the distress levels can be modulated and really kept at a healthy baseline. There are some structural barriers to engaging in a wellness check-in. So as we mentioned at the beginning, the check-in itself is confidential and requires attention to the staff member. And so there could be a lack of confidentiality or physical space to engage in this conversation. And that might be the barrier of why you cannot have that conversation at the set day and time that you perhaps set it up to be at. And lastly, everyone's perhaps least favorite thing is requiring documentation. So depending on the units you work in and the setup of your environments, there might be a requirement to document these types of conversations or these types of meeting, and that might be a barrier because, again, that's connecting to our first point of that it's taking up too much time and there are other important responsibilities that you need to attend to.
So overall, a wellness check-in is going to include 5 different parts, and we're going to go through each and every one of them today. Starting with planning the conversation, preparing for the conversation, actually having the wellness check-in or conversation, and then how do you assist your staff once you've figured out the problem, and how do you follow up? So again, as I mentioned earlier, a wellness check-in occurs within a safe environment. So recognizing when you and the other staff member are feeling safe to have a wellness check-in, and where would that be? So that's why it involves a lot of steps before you start to assist your client. With that being said, planning the conversation is extremely useful when doing a wellness check-in. And then coping ahead, sort of asking yourself, how do you see yourself coping with this situation in the moment? What are you planning to ask the client? What's your intention behind this conversation? What's your intention behind this wellness check-in? And then going ahead and asking that client. When asking your staff to take part in this conversation, recognizing your tone of voice, recognizing your body language, and recognizing your intentions, and asking politely about having a conversation. And be specific in terms of what you are trying to say and what message you're trying to convey. And if a staff member says yes, then ask the staff member for their availability and if they have a preference for a certain location that they want to go to. And if they don't have a preference for location, having that in the back of your mind and where to go and what's a safe place to be in order to offer that for them. Speak to what you notice in the person, in their behavior. So what is fact-based? What is objectively what you see? And come from a point of curiosity. So a lot of your questions might include, or statements might include, I have noticed that you seem distracted and withdrawn lately. And perhaps within that sentence, give an example of where you've seen that. Would it be okay if we set aside some time to meet for a check-in? Noticing that it's an invitation for a check-in and not a requirement. So you're not asking them or not telling them to do a wellness check-in. A statement such as, my interest is understanding how you are doing, and I hope to figure out a way to support you, can sound very polite and genuine. And these sentences can just be used as a way to guide you in your planning the conversation. We don't want people to feel attacked. We don't want people to feel singled out. So this is a really delicate way to plan a conversation and start it. So you want to get buy-in. We really want them to have buy-in and not feel forced. Some people might protest in different ways. So getting buy-in means letting your teammate know that you're there to help them and find support and sort of meeting them where they're at. So understanding where they're coming from. I want to emphasize that it is an informal conversation to check in, and that it's not part of what Leslie mentioned earlier, part of a performance review or anything that will lead to any negative consequences on their work performance review. So staff asserts that, what happens if the staff asserts that nothing is going on? So you want to restate to them that you're just there to connect, that this is informal. Perhaps you want to offer another time to check in. You also might want to validate their perception. You can say something along the lines of, I understand that you feel that you are managing things well, and I want to hear more about what it's like for you. And if there's anything that you find difficult to manage, please let me know. Just know that I'm here and I'm here to support you. What happens if a staff member says that they don't want to speak with you? Well, first off, you want to validate their assertiveness that, hey, it's great that you're being assertive. I appreciate you being honest with me and sharing your thoughts. And perhaps they might feel comfortable talking to someone else. So saying something along the lines of, I know that it can be hard to speak about your feelings with someone in perhaps a managerial position. Would it be helpful to speak to someone other than me? And having that invitation to for them to choose who they want to speak to. Again, this is an informal process to check in. And if the staff is concerned about the conversation, reassure them that it's informal. Let them know that you're only there to support them, and confirm that you will not be documenting the conversation. This doesn't go to any sort of documentation. Now, that depends on what department you're in, so keep that in mind as well. Overall, this is informal and it's not an evaluation. This is just a way to check in with your staff.
Okay. So once you've planned for the conversation, we now have to prepare for the conversation. And this is actually more about you as the facilitator of the conversation here. And so what we are encouraging you to do is to do a self-check. So this is about checking in with yourself, and it is truly crucial because you might have to stay regulated or assertive in order to control the flow of the conversation so that it remains productive and sort of in the lane that it's supposed to remain in. So you really want to be honest with your own self and about what's going on with you. And if you have to reschedule because you're not in the psychological space for the conversation, that's okay. And it's about communicating to the staff member that the rescheduling is not to minimize what's going on with them. It's actually because you want to ensure that you're giving your full attention and giving them the full attention they deserve, I should say. Consider if you're distracted, if you're tired, if you're stressed, if you're having trouble focusing, if there's lots of tasks running through your mind that you need to focus on and get done, and you're going to be distracted from the conversation. Check in whether or not you want the conversation to be rushed. Do you want to get it over with? And recognizing that maybe that's not the best time to engage in this type of conversation. If you do have to reschedule, you can have a simple sort of prompt that we've provided for you. Might be something like, I know we had a check-in scheduled for today and I want to be able to give you my full attention and focus. Can we reschedule in the next day or so? So that, I'm sorry to do this, but I really want to be able to give you my attention. And so it's really about making sure that you're grounded and feeling safe enough that you can proceed with this conversation. So one of the, we love acronyms, and one of the acronyms that we love the most is the HALT acronym, and some of you might have heard of this. So it's really about checking with yourself and asking, am I hungry? Am I angry? Do I feel lonely, or am I tired right now? All of these states are not going to make us as focused and as present. They have the ability to increase our irritability and frustration, and that's going to make having the conversation that much more challenging and less validating for the individual that you're conversing with. So this is one way to do a self-check. We're going to offer a couple different strategies, but this is one way that you can take a minute to sort of check in with yourself and ask yourself, am I in the HALT phases right now? Am I in any of these places? Am I hungry, angry, lonely, or tired? Also notice that when you are hungry, angry, lonely, and tired, your attention is diverted to whatever need that is not being fulfilled right now. So if you're hungry, you're really focused on the rumbling in your tummy. You're thinking about your next meal. When your attention is diverted, you're not able to actually be present and give full attention to the individual that you're conversing with. And so that's why we ask you to do a self-check-in. So a couple of other ways that you can do a self check-in, grounding yourself. So that's the 5, 4, 3, 2, 1 technique. And so what this means is it's grounding with your 5 senses. So we ask, when we do these types of exercises, we ask you to sort of look around your space, wherever you're engaged in, and kind of identify 5 things that you can see, 4 things that you can hear, 3 things that you can touch, 2 things that you can smell, and perhaps 1 thing that you can taste. And so by engaging in these 5 senses, you're really grounding into the present moment, and you're sort of leaving whatever else is around you kind of out at bay. Mindful breathing is another wonderful way to do this. So you can engage in box breathing, and just sort of before you're engaging in the conversation, take a couple of deep breaths and really reassure yourself that you feel like you're in the space to have this conversation. You want to remove distractions. We're going to talk about this shortly when we talk about setting the stage, but you really don't want to have your cell phone going off, receiving text messages, maybe a pager going off, the computer screen on with distractions or emails popping up. Now, we recognize in some situations you can't escape that. You need to have your pager. You need to be able to take the phone because there are emergencies happening, but to the best of your ability, removing distractions and giving sort of your full attention to that moment. Remember the 80-20 rule. You're listening 80% of the time. You're listening to collect data, you're listening for triggers, you're looking for emotion, you're looking for coping styles. That's what you're doing. You're really receiving what that individual is giving you, and you're just holding space for it. You might want to prepare some resources ahead of time, and we're going to do a whole little section on resources towards the end of the presentation, but just having them kind of close and ready to go and being ready to offer them to the staff member. Remember, your focus is solely to understand the staff member. You are not responsible for fixing the issue. There's a reason why we bolded that statement. We really want you to remember that. We're not asking you to fix the problem. We're asking you to just provide space for that staff member to be able to engage in the conversation and have a little bit of a release for whatever is starting to kind of boil up inside of them. Compassion can go a long way. Everybody wants to do a good job at their job. So having compassion for the stress, the suffering, the emotional distress that they're going through, it can have a huge impact. And that's why even engaging this conversation, even offering the conversation can sort of be impactful just in setting up the conversation itself.
And I've read research that validates that. I just want to emphasize that part before we move on to the next slide, is that even just the act of checking in, the consistent, just how you doing, and really trying to get to understand what they're going through can already be very beneficial.
Mm-hmm. Okay, so setting the stage. Now, again, we want to honor the fact that we recognize, you're working in a hospital-based setting and that the picture-perfect space is not always accessible or available. However, to the best of your ability, these are things that we would like you to consider. So first and foremost is having a quiet and confidential space. You want to honor that this person might be sharing some details about their life that perhaps they, are reluctant to share with other colleagues and peers that they're working with. So confidentiality is a really important piece here. It also allows for a really authentic and genuine conversation when the person feels that they have the confidentiality to share their experience. Distractions comes up again. So again, minimizing those distractions. So not having this conversation and texting on your cell phone, not responding to emails while you're engaging in this conversation, and not even necessarily taking notes. This is not what the point of this is. It's really just about hearing, validating, and having compassion for the individual. Body language is huge here. So we purposely selected a picture with 2 folks chatting, facing each other without anything in between them. So usually during performance reviews, management or leaders are behind the desk, and then the individual receiving the performance review is on the other side of the desk. The desk sets a barrier between them, and it also sets up a evaluative component to the interaction, and it also sets up kind of a power dynamic with the person being behind the desk more in charge than the person being in front of the desk. So for this conversation, we want to try to minimize that power dynamic and minimize the evaluative feeling of the conversation. So to the best of your ability, finding two chairs that can face each other without any distractions in between the seats allows for that more authentic and genuine conversation. We want bodies to be facing each other, again, without any distractions in between. And that also allows for eye contact, consistent, I should say, eye contact. And it also just allows for a more healthy and sort of organic conversation.
Yeah, and I think that's really important in that even though you say it's not a formal check-in, but if your stage feels like it is, then they might still perceive it as very formal. So we're actually having a conversation now. We've set the stage, which is the last slide. Now you want to restate the intention and expectation of the conversation. You want to remind the staff that the conversation is informal, private, and confidential. Now, it's really hard to say that it's informal, private, or confidential if you're talking in the hallway where there's people around you, or if the space is buzzing and people are, there's an opportunity for someone to just walk in a room. So you want to make sure that that stage is set first of all, and then remind them that conversation is informal, private, and confidential. Again, let them know that you only want to support them, that you just want to know where they're at. And you're not particularly there to solve a problem. You just want to hear them out. And if there is a problem, then we'll talk about what that looks like later. So you want to provide examples that are specific. And you want to point to their behaviors. So stay away from a lot of probably judgmental words like you are doing that or you are burnt out. That could be just one judgment. You're not really sure. You are feeling blank. That sounds like an assumption, right? You just want to speak to their behavior. You want to speak to what you've been noticing and what patterns you've been noticing as well, and what changes you've also been noticing in their behaviors. I want to bold and highlight that, their behaviors, what you objectively can see, not what you think they're feeling or what you think they're going through. Ask if you can brainstorm ways to support them. So frame it in terms of an invitation. What are some ways that we could tackle this problem? Can you think of some solution to blank? So frame it in terms of a collaborative conversation that you and the staff member are having, and invite the individual to share. So state that they only have to share what feels comfortable for them. So this is not a therapy session, like Leslie said before, right? It's whatever they feel comfortable in sharing, and don't try to really dig too deep into what they might be feeling and what they might be experiencing. So it requires kind of a healthy balance. Ask what has been going on for them, what they have been feeling, or what has been coming up for them. So don't make any assumptions. Come from a point of curiosity and frame your check-in as an invitation with loads of questions. So you really want to get to know where they're at. Example of this is, if you are feeling comfortable to do so, tell me about what has been going on for you lately. Can you follow it up with, I've noticed that you've been showing up late. I just want to know what that's all about. Active listening. I feel like we all know what this is, but sometimes we need a few reminders of what it means to actively listen. When you're actively listening, you're taking in information from what you're hearing, and you're trying to understand it, and you're reflecting it back to the person to let them know that you heard them and that you've at least understood them, right? So one of the many ways you can do this, well, I'm including 4 ways. One of them is to paraphrase. So I find that if you truly understand the information that you're receiving, putting it into your own words can show the other person that you really understand them. So clarify the content, repeat the content, repeat content to show understanding. For example, you might say, what I'm hearing you say is that you are feeling blank, blank, blank as a result of this, this, this. Let me make sure I understand you. You are saying, and you paraphrase it in terms of what you think you heard. And again, these are questions. So you're coming from a point of curiosity here. To be empathetic is to understand the emotions of the other person. So reflecting their emotions back to them. It sounds like you are feeling blank. You are feeling sad because of this experience. So you're really guessworking here, and you wanna and you don't want to assume things. You want to frame it in terms of a question. You want to validate their experience as well. So notice that whatever emotion they feel, it is always valid, right? Just because the same situation can result in different feelings and different emotions in different people, and that's okay. So try to come from a point of trying to understand and be curious to what they're experiencing. So validate their experience. It makes sense you would feel this way, blank, because it always makes sense that they're feeling a certain way. Be aware of nonverbal cues. So a lot of what they're saying can be in the nonverbal. Figure out what their body language is all about. If they're looking down or if they're maintaining eye contact. Affirming nods means they're listening, or it goes both ways as well. And matching their expressions and their emotions. So for example, if you're the opposite of active listening would be if you're texting while talking, or if you're constantly looking around the room and you're not paying attention to the person in front of you, which sounds very common sense, but sometimes you need that reminder. So what are you actually doing? So when you've initiated a conversation, you want to know how you can assist your staff. Again, I want to highlight that you're not here to solve a problem, right? You're not the person to fix a problem for them. You want to help your staff figure out what resources would be helpful for them, if any, right? So ask if they are okay with shifting the conversation to thinking about what the best way to move forward from this conversation would be, or what it would look like. What would be most helpful for them? So eliciting their own ideas, right? And being collaborative with them. So a prompt can mean, one of the prompts can be, this sounds like it's been really challenging for you. It's understandable that you're feeling burnt out, sad, helpless. Would it be helpful for us to brainstorm ways to get support? So it could look like this. Focus on what is important to your staff. Figure out what is under their control versus what is not. Review their current attempts to cope and what has worked in the past. So eliciting their own strengths and what's already working for them. Ask about the self-care or self-management strategies that they want to invest in. And this is really important. That's why we need to prepare for the conversation, is you want to be able to offer resources and ask about barriers to change or support. So before you have this conversation, you want to know what resources are already out there for them. And if you don't, you can brainstorm these ideas with your staff member.
Okay. So we've got more bolded information.
Yeah.
So just want you to remember that you're helping your employees cope with what is going on right now in the present moment and supporting them to be access to access the right resources for their current needs. This is not about historical things. This is about the present moment to help them function and cope in the present. So it's your role as the leader and as the manager to keep the conversation safe for everyone. And that's why we had such an emphasis on that self-check-in before you're even engaging in this wellness check with the staff member. It's also your role to maintain appropriate boundaries. So it's your role to control the conversation if it's deviating to somewhere that's maybe too personal or too emotionally distressing for that individual. And we're going to tell you how to do that shortly. It's also your role to ensure the conversation is remaining focused on the present, always bringing it back to the here and now. So just notice if you're feeling a need to save or fix the individual or save or help the individual based on the content of the conversation. And we really, again, are emphasizing that it's about finding the coping strategies to help with their current needs. With that said, sometimes in a wellness check, things might get out of control, or there might be some oversharing of some really deep or strong emotions. And this might lead to boundaries being crossed or just the distress levels increasing for both yourself and the staff member. So what do we do when strong emotions start to become expressed? So the first thing we want you to do is grounding yourself and self-regulating. So we want to honor the fact that your staff might have some strong reactions, which might be really, really off-putting to you as a leader, as a manager, and might actually trigger some emotional reactions in yourself. So notice that you don't have to say anything. And if you do, you just want to validate their experience. You want to validate that they're demonstrating these strong emotions in front of you. And you can say something along the lines of like, I can see this is really, really hard for you in this moment. I can see how difficult this is. What about thinking about next steps, right? So again, we're not focusing on the content so much. We're focusing on what are we doing moving forward and helping them cope in this moment right now. If you do take a time to sort of break and have a second, after a few minutes, you can offer the choice to them about whether or not they would actually like to continue engaging in the conversation, or would they like a break to sort of gather themselves, to compose, and then move forward. You want to express that their emotional experiences are not abnormal. This is a normal human reaction to stress and burnout, is being overly emotional. This is the nervous system overreacting and being really turned on, essentially. And that's a survival mechanism. So just as Chad mentioned, things like with active listening, nodding along, giving some nonverbal cues that you're understanding, that you're there, that you're present, that you're with them during this, maintaining the eye contact and just sitting with them. Showing yourself that you're becoming distressed based on their reactions is going to kind of heighten their discomfort. So really it's about grounding yourself in that moment to try and keep yourself as composed as you can, to continue driving the conversation in a forward manner and not focusing on the distressing content. So you want to, you don't want the individual to feel too vulnerable with you in an emotional moment and then regret it later. So sometimes during these wellness check-ins, there might be sharing of really personal information that just sort of comes out from that individual. So you want to be able to create appropriate boundaries and reduce the risk for the employee. We don't want that individual to leave the conversation feeling guilty or shameful because they've shared something very vulnerable with you, and then have that impact their workplace environment and feeling like there's a weird connection or just weird energy between yourself as a leader and the staff member. So that might lead them, if they do share this really personal information, to feel like the workplace relationship has changed, as I've mentioned, right? They might start to view you as a safe and comfortable individual with which they want to share more personal or therapeutic experiences with. And that might be a boundary that you want to put in place, because that is not your role, and we want to acknowledge that. And then, as I mentioned, there might be some resentment from them after this conversation for feeling like they were maybe forced to share this information, or it was picked and prodded and dredged up because of the way that the conversation was going. So we need to create a boundary when this information starts to be shared. So how do we do that? We're going to put a pause button. So really, we want to ask the individual that we're conversing with to pause for a moment. So we're doing this when the individual has shared very personal information. If they start speaking historically about events that have happened to them previously, and that includes previous traumas as well. If they insist that you have to know everything for you to truly understand their situation, or if you just need to trust your own judgment and kind of your spidey sense goes off and you go, wait a second, this feels almost too personal now.
Mhm.
So you want to say to them, can we pause for a moment? You want to follow up with a validating statement. And so we've provided some prompts for you here. Something like, I understand that you want to share more detailed information. I don't think I'm equipped or I'm the best person to help you the way that you might need or you're looking for. Or I want to respect your privacy. I want you to have control over the information that you're sharing, and I want you to be able to feel safe with what you're sharing with your leader, or the person that's kind of holding inherent power over you because you're the staff member. So these are ways that you can sort of put pause on the conversation and then validate their experience that they are still sharing something that's incredibly emotional for them.
And you want to respect that too. You want to say that I want to give this more time, perhaps with someone else, which can sound very invalidating. So learning how you can say that using these prompts would be very helpful.
So you also just want to validate what you've heard, and you've heard us use this word multiple times now throughout this workshop of validation. It's incredibly powerful. It reaffirms to the person that their experience is not abnormal. It's a typical experience, or it's a typical reaction, I should say, to whatever they have experienced. So something along the lines of, this sounds really difficult for you. I can see how this has affected you. It makes sense that you'd feel this way. I'm so sorry you've had this experience. That's all validating statements. And it shows that you're recognizing the pain, the discomfort, the distress that they've experienced. And also you don't need to dive into it more. So from there, you want to start to collaborate to make a plan. I want you to know that I care about your well-being and I want to help you in the best way I can. And kind of as Chad just mentioned, right, I don't have the right skills to help you through this or to help you with what you've shared, but we can spend some time thinking about what could be helpful to support you right now. Notice that that brings it right back to the present moment, to the here and now. What do you need right now to cope? And how do I direct you further? How do we put in action steps so that you get the right care that you need moving forward? So the most important goal or outcome of this conversation is kind of thinking in the vein of, if you woke up tomorrow and this issue has been solved, what would be different? What would they like to have be changed? And what action steps can we put in place for this change to happen? So ways that you can sort of have the individual start to brainstorm their own solutions, because that's what that person's going to know what they need best. They're their own person. So you want to get them kind of sparking the ideas. So what's the most important thing for you right now? This is a great statement to lead with if someone comes in with multiple complaints or difficulties. What's the most important thing to you right now? If you woke up tomorrow, what would look different? One of my favorite questions to ask patients is, if you had a magic wand and everything changed, what would the change look like? So it's just getting them to start to envision, what do they want to be different? And then we can actually break that down into action steps to accomplish that goal. What's one thing that we can change that would make the most difference? Again, this is a really great way to distill it if there's multiple difficulties presenting. Or what would give you immediate relief from this? These are ways that you can set priorities for what are we actually going to tackle based on the outcome of this meeting. So it's important to remember what's in your control as facilitator, and also what's in control for the individual you're conversing with. So things that are in the staff member's control is their own opinions, thoughts, and feelings, their own reactions and behaviors, the boundaries that they want to put in place, and how they actually choose to cope. That is all in the staff member's control. What is not in their control and can be a very helpful reminder for folks is the opinions, thoughts, and feelings of others. They do not own those. They belong to the other individual. In the same vein, others' reactions and behaviors, that's not in their control, how other people react. It is that behavior is owned to that other individual. And lastly, others' values and judgments of them. That does not belong to the staff member. So sort of, if that's, I guess, the way that they're coming in with the difficulties they're presenting with, if it's all about an other, you can gently remind them about what they have in their control. And from what they have in their control, like their boundaries and their coping style, that's how we can move into action steps about what we're going to do with the outcome of this wellness check.
So you spent all this time so far talking about how you can start a wellness check and how you can take care of your staff or your staff members. We haven't talked about self-care as much, and I think that's really important. You need to be able to actually have the capacity and the emotional capacity to engage in these types of conversations. And I know a lot of you guys think that self-care is important, and this might just be a review for you, but it really is paramount to the work that you do and the way that you check in with people. So sometimes we often equate self-care with self-gratification. Although the activities that you might enjoy are pleasurable, they also provide us a purpose for what you're doing when it comes to workplace environment. So making sure that you have enough of enjoyable activities incorporated in your day, perhaps adopting mindfulness and grounding practices that are consistent, and spending time talking to your friends and family. When was the last time you've done that? When was the last time you actually gone out during the weekend or week and spend time with friends and family? Making sure that your nutrition is well balanced, you're getting balanced sleep and getting balanced exercise. Having these check-ins throughout the week or throughout the day, knowing your own boundaries and setting them, right? We're talking about how self-care is important. So perhaps when you look at your schedule and you have something booked for yourself, making sure that you don't overbook or double book with different priorities. And if you do, and if you find that you're in that continuum that is in the reactive, injured, or illness phase, perhaps seeking professional help for yourself if you find that that will be useful. And then also having self-compassion, right? We do have another resource for a self-compassion talk and what that's all about. And that's uploaded on the Thrive. But briefly, self-compassion is about being aware of what's coming up for you in the moment, not over-identifying with the pain or the burnout that you're experiencing, and doing something about it. The self-compassion piece is the actual doing something about it in order to take care of yourself, in order to nourish your body. Okay, so I mentioned PHC Thrive. For a lot of people who have seen this for the first time, I think it's a website where it has all these resources, and it's going really fast, and I apologize, but it has all these resources for you to share with a staff member or share or just use for yourself. So I think the website's called phcthrives.providencehealthcare.org, and it shows you all of these wonderful resources, including some recordings about burnout, about self-compassion, and all these other wonderful videos that we have uploaded for you guys on Thrive. As part of Adler Community Health Services and its partnership with Providence Healthcare, we also offer counseling. And in order to access counseling, you can use this QR code.
I've also just put the link in the box. And I just want to highlight as well, this isn't just for staff. This is for all levels of management. So you yourself as leaders can also access individual confidential counseling.
And this is not part of Providence Healthcare in that it's not part of the EFAP system. This is an external source of counseling, and this is completely confidential and doesn't go with any sort of paperwork with PHC or Providence Healthcare, yeah. All right, so finalizing a plan. There's a beginning, middle, and end to this. And don't forget about the ending. So you wanna first identify what steps and potential barriers it might be. So having these prompts like, so it looks like you have a plan to, whatever the plan is. Is there anything you think of that would make it difficult to move forward with the plan? So what you're trying to do here is you're trying to gain commitment from the client, from the staff member. You're trying to assess where they're at and whether or not they will follow through with this plan, and what else you can do to foster that commitment. Asking them how confident they are in their ability to execute the plan can also be one. And what can we do to increase their confidence? Again, you're not there to fix anything. You're just there to help your staff member help themselves, or point them in the right direction in terms of what resources might be helpful for them and whether or not they would access those resources. If the staff is unsure about the next steps, you can say some prompts like, you can take some time to think about next steps, and we can have a discussion in the following week. What would a close family friend member say to you about next steps? So eliciting what other people might advise them to do. You're trying to meet your staff member where they're at, and so if they're not ready, then that's okay, and validate that. Just let them know that you're there to support them either way. And that's why it's really important to have also a follow-up meeting, right? So you want to know where they're at. This might include another wellness check-in along somewhere along the lines, or you can schedule it in this moment. So ask if they would like to follow up, if they would like to schedule a follow-up conversation. Perhaps offer available times and dates to have a follow-up. So again, this is why it's important to prepare for this conversation, so at least you know when you're available and you don't make empty promises. Thank them. Oh my goodness, thank them for their effort to check in with you. I think that's a really important thing as well. And sample dialogues could mean, would you like to have a follow-up conversation? Follow up to this conversation? When would it be a good time for us to connect again? And I appreciate you taking the time to check in with me today.
Okay, let's talk about the follow-up meeting more specifically.
Sure.
So really what you're doing here is you're checking in around how they're doing. You're following up with, did you do what we planned? Did you follow through with the kind of action plan? And did you execute any of the ideas that we actually talked about here? Asking if they were able to access any additional helpful support. So seeing what other social supports they have put in place for themselves after the meeting has occurred, to see whether or not, the utility of continuing with wellness check-ins, or whether or not you need to help provide additional resources so that they can connect with appropriate social supports. And then you can also offer to connect with them at another time. So there might be a wonderful outcome where, they feel like they've been heard, they found the solution they need, and they don't really need a wellness check-in for a while. That's great. But you want to always provide the offer. So again, that going a long way to show compassion, I care about you, even if they decline the offer. So just showing that you are there, you are available if they need additional support with their wellness in terms of supporting their well-being in the workplace. You want to just leave that door open for future check-ins so that it's not this scary process, right? If you can make this the first version of this a really successful, productive, positive experience, you're more likely to get engagement in the future, and then that actually is going to bolster the wellness and the well-being of your entire team. So these little small steps are really, really important in the long run, because we're looking to enhance the wellness of the team so that they function together as a whole. Okay, so that's the wellness check. Important to remember kind of the 5 steps that we've talked about in terms of how you actually conduct the wellness check. Some things that we just want you to take away from the talk today is, taking care of yourself. This is really important work. These conversations can have a really widespread outcome and impact on the team as a whole, and they really can boost the productivity and just the well-being in the workplace. And we know that happier workers, we're going to see better output, and then ultimately in hospital-based settings, better patient care, which is really what we're all we're all hoping for, right? Is to care for the best of our patients. So when you're having these conversations, you want to plan your workday accordingly, schedule them at a time where you know you're at your best, you're at your most attentive, and you're at your most focused and ability to engage. Also know your own limits. Some of you might be able to handle some more distressing and kind of vulnerable pieces of information, and that might make some of you more uncomfortable. So just knowing your own limits and planning those boundaries accordingly, knowing that you can pause the conversation when it gets to a place that's really intense and if you feel like you can't contain it. Be self-aware of your own triggers. So know what types of narratives or what types of information might set you off and cause your own distress. You want to be aware of that. And this is part of why we encourage you to do a self-check-in before you even engage in the conversation. Check in after the check-in, follow up. Follow through. That sends a really important message to the individual that you're conversing with, that this is not just a one-off and this is not just a chore that's being done. There's an actual level of care and an investment in the staff member's well-being from your position as a leader. Know that it's the intent that counts. Know that there's a huge value in this conversation, as we've mentioned throughout this presentation. The outcome is not your responsibility. Your responsibility is to listen, to provide resources, and to come up with an action plan. Your responsibility is to not solve or fix this, and that you're doing your best by even starting to think about wellness in your teams and think about having these types of conversations. So you want to hit the next slide there, Chad?
Sure.
Yeah. So again, welcome to our survey. We are asking that you take a minute or two to fill this out before you carry on with your very busy work days. You've got the QR code there, and I'm going to get Chad to drop that into the chat box once more. So you're going to see two links. I put the link for the counseling referrals, and I can see that there's some questions coming up about the counseling. Counseling does not have to only be related to work, as Chad mentioned. It can be anything the person wants to discuss. We are your wellness support team. We also want to acknowledge that things that happen in your own personal life are also going to impact you in the workplace. So this doesn't have to be this siloed conversation around work as a whole. It can be about anything that you need in terms of supporting yourself.